Welcome to USA Health Claim Coach. Whether you are filing a new claim, appealing a denied claim, understanding your insurance benefits, or learning how to maximize your healthcare coverage, you are exactly in the right place. Here at USA Health Claim Coach, our goal is to simplify the process, save you time, and empower you with the knowledge you need to make informed decisions about your healthcare claims. My promise to you in every single explainer on this channel is simple. By the end of today's lesson, you will have a clear understanding of exactly what steps to take next with your health claim process. No confusion, no complicated insurance jargon, no uncertainty about forms, documents, or eligibility requirements. Just straightforward, easy-to-follow guidance designed to help you navigate out-of-pocket Medicare claims with absolute confidence and peace of mind. So gather your documents, get comfortable, and let's walk through today's lesson together, one clear step at a time. On our agenda today, we're going to cover when to file a claim yourself, gathering your required documents, completing the claim form, checking your claim status, appealing a denied claim, and finally, finding free local help. Let's get started. All right, Section 1, when to file yourself. This is all about understanding your specific role in the claims process. Under normal circumstances, the law requires your doctor, provider, or supplier to actually file Medicare claims for the covered services and supplies you get. They send it directly to Medicare, and you literally don't have to lift a finger. It's great. But there are some rare situations where you have to step onto the field and file the claim yourself. This happens if our provider simply refuses to file the claim, if they are physically or administratively unable to file it, or if you receive services from a provider who is out of network or not enrolled in Medicare. If you paid out of pocket because of one of these reasons, the ball is now in your court. And the exact tool you're going to use for this rare situation is the CMS 1490S claim form. That's the technical name, but it's also known as the Patient's Request for Medical Payment form. Whenever you find yourself needing to ask Medicare to pay you back for covered services you already paid for out of pocket, this form is your golden ticket. Moving on to Section 2, gather your required documents. Basically, getting your equipment ready. Before we even look at the form itself, any good coach will tell you to get your equipment ready first, right? Preparation is everything here. The absolute most critical piece of the puzzle you need to track down is your itemized bill. A standard run-of-the-mill receipt just won't cut it. Your itemized bill absolutely must include these specific details. You'll need the exact date and place of service, your diagnosis or a description of your illness, a detailed breakdown of every single medical service or supply you received, the individual charge for each, and your provider's name, address, and National Provider Identifier, or NPI, if you happen to have it. The crucial takeaway here is that without that itemized bill, your claim simply cannot be processed by Medicare. They'll just send it right back to you. To make things as crystal clear as possible for the people reviewing your claim, you should actually take a pen and literally circle your treating provider's name on the bill. If there are other services on that bill that you've already filed for or that are totally unrelated to this specific claim, just cross them out. Make it impossible for the reviewer to be confused. Okay, Section 3, completing the claim form. It's time to execute the play step by step. Breaking this down into clear steps, you'll be glad to know the form itself is only a few pages long and it's actually incredibly logical. In step 1, you systematically fill out your personal info, your name exactly as it appears on your Medicare card, your Medicare number, and your address. In step 2, you describe the services furnished. And yep, this is exactly where that itemized bill gets attached. In step 3, you detail any other health insurance you might have. For example, if you're over 65 but still working and covered by an employer's plan, which makes Medicare secondary. And finally, step 4, you must sign and date the form. This certifies, under penalty of perjury, that all the information you provided is true. Real quick, I want to take a brief detour to talk about traveling, because the rules get very interesting here. Usually, Medicare does not pay for healthcare outside the U.S., but there are a few exceptions. If you're traveling through Canada between Alaska and another U.S. state without unreasonable delay and have an emergency, or if a foreign hospital is literally closer to your U.S. home than a domestic one, Medicare might actually cover it. But here's my favorite, surprisingly specific rule. For shipboard services, Medicare may pay if you're on a ship in a U.S. port or within exactly 6 hours of arriving at or departing from a U.S. port, assuming the doctor is legally authorized to practice in the U.S., of course. Oh, and if you're filing for shipboard services, you must actually include a copy of the ship's itinerary with your claim. It's a wildly specific detail, but it could literally save you thousands of dollars. Now, I need you to burn this next number into your memory, 12. You have exactly 12 months, one full calendar year, from the exact date of service to file this claim. So if you see a doctor on March 22nd of this year, Medicare absolutely must receive that claim by March 22nd of next year. If you miss this window, Medicare will not pay its share and you will be entirely out of luck. To actually submit your claim, just follow these final steps. First, make a photocopy of your completed form, your itemized bill, and every single attachment. You really want to keep these for your own personal records. Second, you actually cannot submit this form online. You have to find the correct Medicare Administrative Contractor, or MAC, address. Don't worry, there's a large table included right in the form's instructions. You just match your state and the type of service you received to find the exact mailing address. Step 3, put it all in an envelope and mail it physically via the Postal Service. Section 4, checking your claim status, or as we like to call it, reading the scoreboard. Once you've mailed your claim, it's time to track your progress. Remember, we promised no complicated insurance jargon here, so let's clarify 2 terms you're definitely going to see. An MSN is a Medicare Summary Notice. This is simply the notice you get in the mail every 3 months if you have original Medicare. An EOB is an explanation of benefits. That's the exact same type of summary, but it's the notice you get if you have a Medicare Advantage or a Part D prescription drug plan. Both of these documents outline exactly what was billed, the approved amount, what the insurance paid, and what you are ultimately responsible for paying. Checking your status really depends on your specific coverage type. If you sent in a paper claim for original Medicare, expect it to take up to 60 days to process. However, if you create a secure account on Medicare.gov, you can usually see claims pop up online within 24 hours after they finish processing them. If you have Medicare Advantage, just keep an eye out for that explanation of benefits in the mail or contact your plan directly for the most up-to-date timeline. Section 5, appealing a denied claim. What exactly do you do if Medicare says no? Well, if your claim comes back denied, or if you simply disagree with the payment decision they made, do not panic. We have a game plan for that too. Here is another vital number for your playbook: 5. There are 5 distinct levels of appeals available to you in the Medicare system. If you disagree with the decision made at the first level, you generally have the right to take it to the next level, all the way up the chain. And every single time you receive a decision letter, it will include specific instructions on exactly how to move to the next level of appeal. Now, appealing a claim can sometimes feel a bit overwhelming. If you want help, you can easily appoint a trusted family member, a friend, an advocate, or even your doctor to act entirely on your behalf. To do this, you just need to follow 2 really simple steps. Fill out the Appointment of Representative form, which is also known as CMS 1696, and send it in with your appeal to your MAC or your plan. You absolutely do not have to fight these battles on your own. And finally, Section 6, finding free local help. It's time to call in the assistant coaches. If you ever feel stuck on the field, it is time to call in for some backup. And the best assistant coach you can possibly have is SHIP, the State Health Insurance Assistance Program. SHIP is an absolutely incredible, federally funded resource that provides free, completely unbiased, one-on-one, localized insurance counseling. They literally exist specifically to help people just like you navigate the complexities of Medicare billing, enrollment, and appeals. To get this free help, you've got a few options. You can find your local SHIP office by visiting shiphelp.org. Depending on your state, they might go by a different acronym like HICCAP or SHINE, but shiphelp.org will point you in the right direction. You can also call the official 1-800-Medicare hotline, which is staffed 24 hours a day, 7 days a week. Or, as we just discussed, you can formally appoint a representative. The absolute most important takeaway here is that you have a massive support system available to you. You now have the knowledge, the timeline, and the exact steps to handle any surprise medical bill or out-of-pocket expense that requires a manual claim. You know the forms to use, the documents to gather, and exactly where to turn if you need some backup. So I'll leave you with this. The healthcare system is undeniably complex, but millions of dollars go unclaimed every single year simply because people don't know how to fill out a single form. Now that you have the playbook, are you going to leave your money on the table or are you ready to take control?